Depression causes more disability worldwide than any other illness, and in the United States, nearly 10% of adults struggle with it. Yet it is often misunderstood because it is a mental illness rather than a visible physical condition. One of the main challenges is distinguishing between feeling depressed and having clinical depression. Since everyone experiences sadness at times due to situations like poor grades, job loss, conflicts, bad weather, or sometimes for no clear reason at all. And these feelings usually fade once circumstances change. Clinical depression, however, is a medical condition that does not disappear simply through willpower. It lasts for at least 2 consecutive weeks and significantly interferes with daily functioning, work, relationships, and leisure activities. It can present through many symptoms such as persistent low mood, loss of interest in previously enjoyed activities, changes in appetite, excessive guilt or feelings of worthlessness, sleeping too much or too little, difficulty concentrating, agitation or sluggishness, low energy, and recurring thoughts of death or suicide. Treatment often involves a combination of medication and therapy to improve brain chemistry, and in severe cases, electroconvulsive therapy has proven effective, while newer approaches like transcranial magnetic stimulation are also being explored. If you know someone with depression, gently encouraging them to seek help and assisting with practical steps like finding a therapist or preparing questions for a doctor can make a meaningful difference, as these tasks may feel overwhelming to them. It is important to remind them that depression is a disease, not a personal weakness or character flaw, and should not be compared to ordinary sadness, as such comparisons can increase guilt and isolation. Open and honest conversations about mental health, including asking about suicidal thoughts, can actually reduce suicide risk, help break stigma, encourage people to seek treatment, and ultimately support better understanding and improve treatments for depression. Depression can lessen through a combination of biological, psychological, and social factors that support mental well-being over time. Proper treatment plays a major role, as antidepressant medications help balance brain chemicals, while psychotherapy enables individuals to understand negative thought patterns, manage stress, and develop healthier coping skills. Strong social support from family, friends, or support groups can reduce feelings of isolation and provide emotional reassurance. Lifestyle changes such as regular physical exercise, balanced nutrition, adequate sleep, and limiting alcohol or substance use have also been shown to improve mood and overall brain health. Learning stress management techniques like mindfulness, meditation, or relaxation exercises can help regulate emotions and reduce anxiety that often worsens depression. Addressing underlying causes such as trauma, chronic stress, financial strain, or unresolved grief through counseling can further ease symptoms. Additionally, reducing stigma and increasing mental health awareness encourages people to seek help earlier, which leads to better outcomes. When individuals feel understood, supported, and have access to proper care, the intensity and duration of depression can gradually decrease, allowing them to regain functioning, hope, and quality of life. Building hope and self-compassion is another important way to reduce depression. Setting small, realistic goals helps restore a sense of purpose and achievement, while practicing self-kindness reduces harsh self-criticism that often fuels depressive thoughts. Engaging in activities that bring meaning, such as creative work, volunteering, or spiritual practices, can slowly rebuild motivation and emotional strength. Over time, these positive experiences help individuals regain confidence, improve mood, and develop resilience against future depressive episodes. Developing emotional awareness and acceptance also helps in reducing depression by allowing individuals to understand and manage their feelings more effectively. Recognizing emotions without judgment makes it easier to process pain instead of suppressing it, which often worsens depressive symptoms. Learning to express emotions through talking, writing, or creative outlets can provide relief and clarity. Accepting that difficult emotions are part of the healing process reduces inner conflict and builds emotional balance. With time, this awareness strengthens coping skills, promotes inner peace, and supports long-term mental well-being. Creating a supportive and structured environment can further help in managing depression and maintaining emotional stability. Organizing daily routines, maintaining a clean and calm living space, and reducing unnecessary stressors provide a sense of control and safety. Surrounding oneself with positive influences and limiting exposure to negativity, including excessive social media or distressing news, can protect mental health. A stable environment encourages consistency, reduces overwhelm, and helps individuals feel more grounded. Over time, these small but meaningful adjustments support recovery and promote lasting emotional strength. Practicing gratitude and focusing on positive moments can also contribute to reducing depression over time. Taking a few moments each day to acknowledge small blessings or achievements helps shift attention away from constant negative thinking. Writing in a gratitude journal or reflecting on positive experiences strengthens a more balanced perspective on life. This habit does not ignore difficulties but allows space for hope and appreciation alongside them. Gradually, gratitude can improve mood, increase emotional resilience, and support a more optimistic outlook. Building healthy relationships plays an important role in easing depression and supporting emotional recovery. Feeling understood, respected, and valued by others strengthens self-esteem and reduces loneliness. Open communication and mutual support create a sense of belonging, which can be deeply comforting during difficult times. Over time, positive relationships provide emotional stability and encouragement to keep moving forward. Developing healthy coping strategies helps individuals manage depressive symptoms more effectively. Learning how to respond to stress through relaxation techniques, journaling, or problem solving reduces emotional overload. These skills empower individuals to face challenges with greater confidence and prevent emotions from becoming overwhelming. With practice, coping strategies become tools for long-term emotional balance. Allowing time for rest and self-care is essential in the journey of healing from depression. Taking breaks, setting boundaries, and listening to one's physical and emotional needs prevent burnout. Self-care activities, whether simple or meaningful, help restore energy and inner calm. Over time, consistent self-care nurtures resilience and supports lasting mental well-being.